Are you experiencing heightened sensitivity after a dental cleaning? You're not alone. It's a common issue caused by various factors like gum recession or certain cleaning techniques. But fear not, there are steps you can take to manage and alleviate this discomfort. Before we dive into solutions, let's explore why this sensitivity might occur. Gum recession or exposure of tooth roots during cleaning are common culprits. But worry not, there are ways to ease this discomfort. Here are the steps to alleviate sensitivity. First, if sensitivity persists, it's essential to consult your dentist. They'll assess the severity and guide you on the best steps forward. Second, preparation is key. Start using desensitizing toothpaste for sensitive teeth at least 2 weeks before your dental cleaning to block those sensitive nerve signals. Third, limiting acidic foods and beverages can significantly reduce sensitivity, as high concentration foods and extreme temperatures stimulate dentinal nerve endings. Avoiding them for at least 10 days is a good way to get relief from sensitivity. Fourth, use a soft bristle toothbrush and gentle techniques to prevent further irritation of teeth while brushing. Hard bristles traumatize the inflamed gums after brushing. While smooth bristles reduce this irritation, they also aid in faster healing of gums after dental cleaning. Fifth, employing a warm saltwater rinse serves as a simple yet remarkably effective method to alleviate discomfort associated with post-dental cleaning sensitivity. This age-old remedy works wonders by harnessing the natural healing properties of salt water to gently soothe and calm inflamed gums. The solution's gentle warmth helps reduce irritation and inflammation, providing a soothing effect that eases the discomfort caused by heightened sensitivity. Regular rinsing with this saline solution can aid in promoting healing, making it an easy and accessible way to manage the temporary sensitivity experienced after a dental cleaning. Sixth, including fluoride mouthwash as part of your daily oral care regimen offers significant benefits beyond fresh breath. This specialized mouthwash not only freshens your breath, but also plays a vital role in fortifying the tooth surface. By infusing the enamel with fluoride, this mouthwash helps create a protective shield, reducing the chances of sensitivity. Moreover, it aids in remineralizing weakened areas, bolstering the overall strength of your teeth. With regular use, fluoride mouthwash contributes to a more resilient and less sensitive dental structure, ensuring a more comfortable experience after dental cleaning. Seventh, in the week following your dental cleaning, it's advisable to avoid hard or crunchy foods that might exacerbate any discomfort. Opting for softer food options during this period can significantly reduce the strain on sensitive teeth and gums. Steering clear of tough or crunchy textures ensures that you don't inadvertently aggravate any areas that might be tender or sensitive after the cleaning process. This temporary adjustment in your diet can contribute to a more comfortable recovery, allowing your mouth to heal effectively without unnecessary stress or irritation. Eighth, following a dental cleaning, it's common to notice roughness on the tooth surfaces. This texture might prompt your tongue to inadvertently rub against these rough areas, potentially leading to tongue ulcers. Avoiding continuous contact between your tongue and these rough surfaces is crucial to prevent such discomfort. Consistently rubbing the tongue against these areas can further irritate them, exacerbating tooth sensitivity and causing significant discomfort. Being mindful of this interaction can help minimize irritation, ensuring a smoother recovery post-cleaning, and reducing the likelihood of added sensitivity-related issues. Ninth, monitor any changes closely. If you notice persistent or escalating sensitivity, it's vital to seek guidance from your dentist for a more thorough evaluation. Your dentist can provide tailored advice and necessary interventions to address any lingering sensitivity issues effectively. Don't hesitate to reach out if the discomfort continues or intensifies, as timely professional insight can make a significant difference in managing and alleviating post-dental cleaning sensitivity. Ensuring proactive oral care remains essential for a healthy dental routine. Consistently maintaining excellent oral hygiene and scheduling routine dental checkups are pivotal steps in guaranteeing a comfortable dental experience while preventing potential future issues. These habits lay the groundwork for a robust dental health routine, supporting your efforts to manage sensitivity after a dental cleaning effectively. As we wrap up, remember that your dental health journey is ongoing. Your commitment to these practices is key to not only managing sensitivity post-cleaning, but also to fostering a lifetime of optimal dental health. By staying proactive, you're not just alleviating discomfort, but setting the stage for a healthier, happier smile.